Hello, welcome everyone to tonight's Health and Human Services Committee for the City of Hartford. Today's Monday, December 7th, 2020. We are live streaming on HPA-TV.org and live on Channel 96 on Comcast and Frontier. And the meeting will be available via YouTube on the HPA-TV website in the coming days. So for today's meeting, we have, I'm just going to announce everyone. We have our committee members, Councilwoman Rossetti and Councilman Gale and Majority Leader Clark. We also have on the line Corporation Counsel Damar Osborne and Director Liani Arroyo. So thank you everyone for attending tonight. I appreciate it. So first we'll go over the first resolution, which is Mayor Broning with the accompanying resolution authorizing the City of Hartford's Department of Health and Human Services to receive annual funding from the State Department of Public Health to promote community health education, which is referred to as per capita grant funds. So Director Arroyo, the floor is yours.
Good evening, everyone. Thank you for hosting this meeting to review these resolutions. This first resolution is funding that we receive from the state of Connecticut on a yearly basis that's allocated by our population. We receive, I believe it's $1.18 per resident, and then we're allowed to carry over funding if we do not use all of the funding from the previous year. So this funding amount represents our annual allocation plus additional carryover funding that we have received. This funding will be used for a variety of purposes. We are paying for one full-time staff person to work on our lead education and lead case management program. So that is whenever an individual is, whenever a child is found to have a high lead level, depending on the level, there are a series of services that we are required to provide. The most basic service, which is really the bulk of the work, is providing that family with information about lead, as well as information on how to reduce lead, cleaning, and things of that nature, and then referral to that property owner to our lead abatement program. And then the second intervention is really going in and requiring an abatement of that property. And so we're lucky to have a lead abatement program that is funded by HUD that we're able to funnel many of the properties involved in these cases too, which has been a great help to us in bringing down the number of children who are exposed to lead in our city every year. So that funding will pay for that staff person. It will pay for a portion of our staff person that is on the Ryan White program. The Ryan White program is the program where we provide individuals who are HIV positive or people living with AIDS in our community, as well as the Tal and the Middlesex County communities, with access to services, dental, psychosocial support, as well as clinical services for individuals that cannot pay. So that grant does not cover everything that it's supposed to be covered in terms of the staffing, and so this will cover a portion of that individual as well. And then the other funding is dedicated to a number of other things that we do. Community education is part of that. Right now, we are working on a rodent campaign, as well as we will be doing a new rodenticide. We're actually going to be doing rat birth control. So we're going to be starting that program early part of next year in an effort to control the rodent population in our city. As you're aware, that's a big issue, not just in Hartford, but really across the country. For a number of reasons, and the pandemic has made it worse. So we are trying some new things. We did dry ice. That has been successful somewhat, but with the pandemic and the amount of rodents that we had, and really a little more aggressive that they're getting, frankly, we're going to start using rodent birth control. So that's something that will start happening. So this funding will also be used to help pay for that, as well as other smaller activities throughout the year. So from providing funding for the World AIDS Day event that is done by our Ryan White program, to partially funding the Hartford Food Systems for the North End Farmers Market as another option, another piece of the work that we partially fund as well. So that's what this funding is for. It has to hew to health programs, and the state does approve the use of this funding based on an application that we submit every year.
Thank you, Director. Sounds like you guys are really maximizing the use of this per capita grant. Any questions from my colleagues? Yes, Councilman Gale.
Yeah, thank you, Mr. Chair, and good evening, Director Arroyo. Nice to hear you anyway. So, yeah, I do have a couple of questions. I'll go last first. You mentioned at the end there dealing with rodent problems, and I know that I fielded some questions from some concerned citizens earlier in the I think back in the summertime on the city's rodent control issues and the issue of baiting. Can you talk a little bit about where we are with respect to our ability to do rat baiting at this point in time?
So we are actively baiting. We did restart. It has been a little slow. We recently promoted one of our rodent control inspectors, which is a great thing for us and for the city in terms of providing a Hartford resident an opportunity to move up. So we are a little short-staffed, but that position has been posted. So we do have an open position there, but we have actively started baiting. It's not full-fledged the way we were prior to the shutdown, but we're working towards that. And we are also working on contingency plans to not be in the position that we were in. So we're actively working with HR on ensuring that that doesn't happen again.
And so just so folks understand, the position we were in is that there was just one person who was able to do the baiting for the city, and when that person wasn't available, the city was without the ability for some weeks or some period of time. The city was unable to do baiting. Is that the idea?
So actually, no, we had 3 individuals who could bait, but there was one supervisory pesticide license that was held by one individual in a supervisory role, and that person is on leave, unfortunately, but they are back in a limited capacity working with us specifically on baiting. So we do have the 3 inspectors. At this point in time, we're down 1 because one person was recently promoted. But you all approved, I believe 2 years ago now, or 2 budget cycles ago, a larger rodent control program. And so that's what we've been working with. We have 3 rodent control inspectors for the last year. That was the first full year of the program. And now we've done that baiting, and part of that baiting was related to also trying new and different techniques, and that's what we've been doing. But with regards to the supervisory certificate that is needed, that is a state of Connecticut requirement. And that is what we're actively working with HR to identify other individuals in the department that could take that course and be able to do this work.
So that's the redundancy that you're talking about, is trying to get somebody else.
Yes.
Okay.
Yes, so that if we ever run into a situation like we did this over the summer, that we have a second person that we can bring in.
Okay, but our supervisor right now is back on the job in some limited capacity and can authorize. And is
yes.
we are able to authorize the actual baiting of for rats.
Yes, yes,
okay.
we can. And I think the other thing to remember is, you know, on private property baiting, is really and truly is the responsibility of the property manager. But we do run into properties where sometimes people are not as willing to work with us, and that's when we would actively bait. We do not bait the same property endlessly. Our job is to get in there, help that property owner manage that issue, particularly on multifamily units, and then work with them, with the property management company or the owner of the property, to then set up a rodent or a pest management plan.
Got it. Thank you.
So while we weren't baiting, we were actively working, calling property owners, asking for their pest management plan, working with them to get the dumpsters changed, because dumpsters rot at the bottom and a lot of property owners don't realize that. So we did a lot of that kind of work, but the baiting to help get things started was what was missing, and now we've been actively doing it now.
Okay, thank you. Thank you very much. Second question on the lead abatement. I'm wondering if you have or can tell us some idea of the number of properties that the city is able to address in the course of a year. Do we keep it in? We keep our statistics in that fashion?
So I don't have it readily available by a year at this point in time handy. I can get that for you. I do know that in our 3-year grant that we get with HUD, on a 3-year cycle, we commit to rehabilitating or abating, I believe, 192 or 198 properties. Or units, shall I say, not properties, units.
And when you say commit to abating 198 units, that's a pretty specific number. What is the you must have some pretty specific idea of what abating consists of with respect to those units.
So the HUD program has a limit of $20,000 per unit. We budget, because of our knowledge of the community and the units that we tend to get called into to do the remediation or the abatement, we budget about $12,000 per unit for that abatement process. And so the calculations of what we're able to do, it's based on our capability in terms of the capacity of our of the vendors that we work with, and the amount of available funding and what we were able to do in the previous 3-year cycle. We will budget that $12,000 against that the money that's available that we think that we can successfully compete for, and then identify how many units we can do. Sometimes units are less money to abate, sometimes they're more expensive to abate, and so we work with the property owners to determine what's the best way to move forward, and with our vendors, the actual abaters, contractors, to determine what's the best way to move forward. In most cases, we are encapsulating the lead so that it is not detrimental to children. It cannot be reached. That often focuses on window moldings, making sure that paint that has lead inside a unit, if it can be removed, it's removed, and then the walls resealed and painted. So there's a variety of things that can happen, leading to why we have a very specific number. It is a grant, and that is the number that we have in the grant.
Thank you very much. Thank you, Mr. Chair.
Open up the floor to my colleagues, Majority Leader Clark or Councilwoman Rossetti. Any questions? I have a question. So, Director, you said something. I know you said baiting. You and Councilman Gale talked about baiting for the rats, but then you said another word that was raised my eyebrows, which was birth control. Is that something different, or is that something new that you're going to be rolling out, or can you just, touch on it briefly? Because I would like to know how we're going to make sure these rats line up for birth control.
So, there are a number of things that can be used to control a rat population. This is not something I thought I'd do in my career, but I was warned when I first accepted this job that would be one of my largest responsibilities, rodents. So I've learned a lot over the last 3 years about rodents. And so there's a number of things that you can do. You can apply Rodenticide, which has been what the city has done in the past. So that is essentially applying poison to kill rodents. The use of Rodenticide is very tightly controlled by DEEP here at the state. And so there are situations where we can't apply it. So that's all we've been doing the past number of years. And after coming here, after sending a staff member to the New York City Rodent Academy, and yes, that does exist, and people come from all over the country to attend. We did send someone my first year there. And so after sending someone there, she came back with a whole host of different information and different opportunities. We also, and myself, did research of what different places were also doing across the country to control their rodent populations, with an emphasis on the larger cities that had just recently moved here from the Washington, D.C. area, so was very familiar with rodents after being and living and working in Washington, D.C. for 10 years. And so really looked at to what all these other cities were doing. And they're using a combination of things. Some use rodenticide as one option, but rats are smart, and so they know if it's something, and they've eaten it before, and they understand, and they figure things out. So we changed the type of rodenticide we were using. That seemed to help a little bit, but again, rats, they are kind of very smart creatures. They've survived millennia. And so then we started using dry ice, which is a mechanism to basically suffocate them in their burrows. And that's been helpful as a part of our toolbox, part of the arsenal that we have. And now the next step is really it's essentially making rodents infertile, the female rodents infertile. And so it is essentially pellets that are put in the burrow, looks like food, they eat it, and then it essentially makes the female rodents infertile. I mean, these, the rats that we have in the Northeast, they reproduce every 14 days. And so it's really about interrupting that reproduction cycle in which that we can help to control the population in the city. It's the rodenticide, it's the dry ice, and now this new item that has been made available to us that we are going to be purchasing and working with the company to use.
Right. I just any last minute questions from my colleagues? Anyone want to make a motion?
So moved.
All in favor of approving?
I'll just repeat the motion. That was a motion to send it back favorably to council.
Oh, I'm sorry.
Yes.
I'm used to
So we have
another
a motion.
committee I'm on.
Yeah. So we have a motion on the table to send the item back to council.
I second it.
Favorably, yep.
All right. All in favor, say aye.
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 Opposed? There's no opposed. The item has been passed and will be passed on favorably to the council meeting. Thank you. All right. The second resolution we're going to be going over today is the resolution from Mayor Bronin authorizing the City Department of Health and Human Service to receive annual funding from the State Department of Public Health to promote safety and prevent falls by aging and elderly residents. The floor is yours, Director.
Great. So this is pass-through funding from the Centers for Disease Control and Prevention that comes from the state of Connecticut. It is a relatively small grant. It pays for a portion of a public health nurse that we recently made an offer to that was accepted. So we're excited about bringing on a new public health nurse. It pays, I believe, 35 to 40% of her time. And then the rest of the funding actually goes to purchasing materials that help our elderly population age in place safely and prevent falls, slip, trips, and falls that can happen in their home. And so the way the program works is we pair this program with a evidence-based intervention that works with the seniors to provide them tools in their own home about keeping balance, but then also does an audit of problematic areas in their home that that could potentially cause them to slip, trip, or fall. So the funding is buys chairs for shower bathroom chairs for elderly individuals to take baths and to take their showers. It provides toilet risers so that our elderly residents don't have to sit so low on the toilet seat. It raises the toilet seat substantially higher to make it easier for them to avoid a fall. So it helps to install grab bars in showers or bathrooms, night lights that they can use to help them avoid slipping on the floor, and then if there's non-slip rugs that they might need for their bathroom. These types of items are what are provided. I believe we reach about 50 think it's 50 elderly residents a year. So it's not a large program. Again, it's a small amount of funding, but we have been able to marry this program, or not marry, or sort of bring this program together with other programs that are for our elderly population that are small pots of funding to provide a larger suite of services to our elders in our community. So we go in, we do this, we do prescription audits, we do a whole host of other things that can help our population age in place if that's what they so choose.
Thank you. Any questions from my council colleagues? All right, I have a question. Director, how do we, as you said, it's about 50 elderly citizens. How do we identify who's that 50?
So it comes through a variety of mechanisms. It could be referrals from CBOs, referrals from the hospitals. Oftentimes that's a big source, is referrals from the hospitals. It could also be, we get referrals for a home health program where we send individuals home health aides. We pay for home health aides to help individuals coming out of the hospital, usually elderly individuals over 60, who may need some assistance with activities of daily living. So if one of the home health aides goes into the home and sees any issues, they can refer to the program as well. So it is a referral-based system. And if I recall as well, our senior centers are also referring to it.
Great, thank you. Just another question. The wantingness of this from our citizens, is there a wait list? Or, how does it normally work? Is there a high desire for this or a high need?
I will say that when we do reach out to the individuals after a referral, I don't think we get many people saying no. I don't believe we have a wait list. As with all programs, I'm sure if I had more money, more staff, I can expand it. So I think right now where we're at, it's a happy medium between the amount of funding and staff we have that we can dedicate to this and the demand that we have. But if there were additional funding available, then I'm sure that we would be able to drum up demands and do more.
Okay, thank you so much. Barring any further questions, I would entertain a motion.
Councilman Gale, do you want to get that?
So moved. No. Move to send it back to council with a favorable recommendation.
I'll second that.
Motion has been made and properly seconded. All in favor, say aye.
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 Any opposed? Seeing none opposed, this resolution will go back favorably to the city council meeting next week. So we have, as we all know, we are still in the middle of a pandemic and facing a second surge. So regarding COVID, myself and our committee always like to engage with Director Arroyo around COVID-related items as it is at that moment. And I will first say that folks should and can look up, the CDC websites, the City of Hartford website, Facebook pages. There's a ton of information out there regarding COVID. But what we hope to do today is go over some high-level items and try to debunk some, not myths, but some questions that folks have and get our viewpoint on where we stand in the city. So, Director Arroyo, we just finished Thanksgiving, and where people usually get together. I will say folks have been trying to be responsible, at least as I've seen from folks in the city of Hartford. But we also have a major holidays coming up in the coming weeks in December for most of our citizens. And so during these holiday times, folks normally engage with families. But can you give us some quick FAQs or frequently asked questions or some quick comments on how to remain safe this holiday season and some suggestions to remain safe this holiday season for 2020?
So I would say that, let me give a larger context, and then I'll go into your question, Councilman Lebron. So you are right. We are still in the midst of a global pandemic, and I know that our community is very tired. We are, rounding the corner on month 10 of this. And, my team is very tired as well. We are working evenings and in the weekends to try and do the best job that we can to keep residents informed through a variety of mechanisms, mainly partnerships with community groups and trusted sources of information at the local level, using the media as well, and really engaging in our contact tracing process. I will say that we've been very lucky. Our residents have been very engaged with our contact tracing process. We've had some bumps here and there with, sometimes certain segments of the population not wanting to provide information, sometimes people feeling fearful, embarrassed, stigma around having been diagnosed with COVID-19. But the overwhelming number of our residents are cooperating with our contact tracers when they receive that phone call. And so, we continue to do our own contact tracing. The state does back us up as needed. At this point in time, we have 15 full-time contact tracers through the CDC Foundation, which has been fantastic. And then we have about 5 volunteers that are on a part-time basis through the Medical Reserve Corps. And then we have staff members who come in and back up as needed as well. Our contact tracers are tracing 12 hours a day in shifts. So we're pretty much calling people from 8 a.m. in the morning to 8 p.m. in the evening. I've told my team, don't disrupt the novelas because people are not going to pick up if we do that. So we're trying to be mindful and respectful of that as well.
I hear you. It's important.
So it is very important. I'm like, don't call during Wheel of Fortune, try not to call during the novelas, that kind of stuff. But, our residents have, to their credit, have done a really good job in trying to give us the information that they have. And sometimes it takes a couple of days to build that trust and work with them, but we are doing that, and we're able to do that because we do have a generally diverse set of contact tracers. We wish that there could even be more diversity there, and we're working on that as well. But we do try to match our contact tracers on gender, race and ethnicity, and age to the extent possible, and then obviously language. So, this weekend did bring in a large number of cases. It is likely the start of that Thanksgiving surge that we were expecting and we were getting ourselves ready and prepared for. So we're seeing that now coming through. We will see what these numbers look like over the next week. So it will likely get worse before it hopefully gets better. But that's, what we're seeing in our numbers is no different than what other places are seeing around the country. The population that is being most affected at this point in time, it is our Latino population right now. For when we do get data for on race and ethnicity on the testing data, on the positive data, what we're seeing is about 50% of the data that has race and ethnicity is usually Latinos. It fluctuates between 40 to 50%. But then when we start actually calling, the missing data starts getting filled in because we see the last names, we see the zip codes they're coming from, and then when we start calling them, we hear them speaking Spanish. So my epidemiologist estimates that probably closer to 60, maybe 65% of our infections at this point in time are amongst the Latino community. We've definitely seen lower numbers in the African-American community over time, but it also, that's our second highest group, and those numbers can fluctuate in terms of what percentage they are of the total cases that we have. So it is quite concerning and alarming to us that that's happening, and so we're working to do more Spanish language work and things of that nature to address that. Our community can't tell us oftentimes where they've acquired the infection. What we do know is that once an infection is acquired, it will spread through the entire home. We have spoken to families where one person was the one feeling the symptoms, got tested positive, the whole house got tested, and they're all positive. And so it's 5 people, 6 people, 7 people, 8 people in a home. depending on how large a family is, but we're seeing a lot of, 4 to 6 family homes, person homes being infected. And again, oftentimes they can't tell us who the first person was that got infected, but that's what we're seeing. I'd like to add that we are working very, very closely with Hartford Public Schools on working to keep our children and the individuals in that building, staff, including teachers, as safe as we can during this time. What we're seeing there is very good adoption and implementation of the mitigation strategies that have been laid out by the state. People are wearing their masks with very, very, very few exceptions. They're keeping distance in the schools. And then any numbers that are reported, what we've seen is that the vast majority, overwhelming majority of the infections can be traced to an exposure outside of the school system. And so that's something that we didn't know would be the case in June, but we've been able to keep the schools open in some capacity. So I'm, very pleased with seeing that and the work that Superintendent Torres Rodriguez has done with her team has been amazing. So I just want to call that out because I think they've done an amazing job, and they work hand in hand with us, and we're in contact with them virtually every day about what's happening and working with them and providing our expertise and them teaching us about children and their needs and the needs of our community as well. So it's been a nice collaboration there. But, big picture is if you want to stay safe, if you can stay home, stay home. If you have to work, because we know that people need to work, you need to wear your mask and keep your distance. Wearing your mask is not an excuse to sit right next to somebody. You still need to keep that physical distance. It's both of those things in conjunction with each other and with the regular washing of your hands that are going to keep you safe. There's more COVID in the community, so there's more opportunities for you to come into contact with COVID. And that's why it is critically important to really stick to the people in your household. I know it's really hard. I come from, a big Puerto Rican family. Thanksgiving is 40 people in someone, in someone's basement or in someone's living room. We did not do that this year. And we will not do that for Christmas either because it's just too risky. There is a tool from I think it's University of Georgia or Georgia State. I can't remember which one, but it's from one of the state universities in the state of Georgia that gives you the odds or the percentage of, depending on how large the gathering is, by county, the percentage that someone in that gathering could be infected with COVID. The last time I checked, which was right before Thanksgiving, in Hartford County, if 10 people got together in a room, there was a 20% chance that someone in that room had COVID. I suspect that number will continue to increase as our numbers increase. So again, your best thing to do is to celebrate small, really celebrate with those individuals that live under your roof. And if you can't do that, because we understand that loneliness sets in, that some of our elderly citizens and other individuals live by themselves and need that human connection that is vital and that is important to health as well, that if you do have to get together, that you wear masks indoors, even if they're your family, that you still maintain distance, even if they're your family. And to the extent that you can, and I know this is harder because it's colder now, keeping a window open helps dissipate the amount of virus that may be in the air if someone's coughing or sneezing or even talking or singing, which can aerolize the virus inside a home. If you open a window, that moves the air around and dissipates that virus more rapidly, lowering the opportunity for you to become infected. But, I give those tips because I know people are going to do what they're going to do. But really, the only way we're going to stop this is by doing what we did at the beginning, which was really sticking to just those people living under your roof. I think you're all aware that a COVID vaccine is coming. The city is preparing itself to do vaccination clinics. What our role will be as a health department is still slightly unclear, just because it's not something that we determine. There are comes from the Fed, comes down to the state, and then the state makes determinations as well. And then that will help us determine our role. But at this point in time, we have purchased another refrigerator. We are purchasing the tools needed to log vaccinations and the tools needed to register individuals for vaccinations. And we will be working to be ready to help vaccinate municipal employees and other essential workers and the general public when there is enough vaccine to do that. But we're really preparing the community at this point in time to learn more about COVID, learn more about vaccine safety, so that when a vaccine does come down the pike, they feel more comfortable with it and are more willing to get it. Because we can have as much vaccine, I can have 123,000 doses to cover every single man, woman, and child in this city. If the community doesn't feel that it's safe, they're not going to do it. And so we need to work on that, and we're going to be launching shortly a website, a microsite that has information about Hartford and COVID and where to get tested, as well as vaccine safety. And then also we've done focus groups, and we will be developing messages that will be used to promote the vaccine when we have enough to give to the general public. But that is a lot, but I just wanted to give that overview to everyone.
Yeah, so there's a couple questions on vaccine, but going back to this safe holidays or best practices, and I know you gave some tips as an overview, but there is folks who have been out there, at least for Thanksgiving, who said that, they would take a test. I think on the news, they even, Thanksgiving's on a Thursday. They said they'll take the test by Friday, that previous Friday. They'll get their results. During that time, they would quarantine and then be able to get together on Thanksgiving. Is that okay in terms of thinking if folks approach it that way? Or is that something that I would imagine that you probably wouldn't recommend, but nonetheless, folks are doing that. So what do you think about that?
So that is a risk mitigation strategy. It doesn't make the risk zero. So I just want to put that in context. A test is a point in time. When you get tested, it is that day at that time you do not have COVID-19. Even if you quarantine right after, you could have tested too early. There was not enough virus in your system. So I think we want to rely on tests. We need tests. Testing is a part of the way to control this virus. And, to our governor's credit and to the state government's credit, they've done an amazing job of making sure that everyone has access, no matter their ability to pay, to testing. And so obviously we want to do that, but we don't want an over-reliance on testing. You still have to do these other strategies. So if you're going to meet with someone and you can access a test, that's great, that's fantastic. It still wouldn't negate the need to wear a mask indoors. It still wouldn't negate the need to do social distancing. Again, because I might have been exposed 2 days ago and I get tested and maybe the virus has not had enough time to replicate in my system to be detectable by a test, and I get tested and I still stay home and I'm completely asymptomatic. 3 days later, I go to a Christmas event and I can be positive and not know it. And so those are the things that we have to keep in mind. A test that would not negate the need for the other mitigation strategies. So yes, get tested if you can, absolutely. But it still means you have to do the other things.
All right. So my colleagues, I'm sorry. Do you guys have any questions? Yes, Councilwoman Rossetti.
More of a comment. Again, I know I say this every Health and Human Services meeting. I can't thank you enough for the work you've done. I can't see your lovely face this time, but I know you're out there. Really, this has been unprecedented. I was sitting here thinking of our last in-person meeting back in March, I think. Maybe it was February, March. And I just remember you saying to, I forget how you put it, but it was like, let's just, stay calm, and who knew what you would have to undertake. And I can't thank you enough. And I just wanted an update on the, as far as our facility, my other hat at the Open Hearth, we've gone back to every 2-week testing because of certainly the environment. And we did have a positive after months of negatives. But we just had testing last Wednesday, and we are back to all negatives again, even though we're still going to do every 2 weeks. So I think that's, again, still, even though I send out an email right afterwards, all negative, but that doesn't negate hand washing, socially distancing, mask wearing. We've done HEPA filters, just everything you can think of, doorknob washing. So again, I thank you so very much.
Well, thank you. And I, it's not easy doing what we're doing, and my team, like I said, we're trying to do the best that we can with the information that we have. And I know it's frustrating to community members sometimes because we're saying one thing and then it might change a month later. It's not that our experts don't know what they're doing. It's that this is still a new virus and we're learning something about it all the time. And so it means that we have to adjust our messages. So, I thank you all for all of your support. I will say, I feel very lucky to be here with the leadership that we have and the work that's been happening. So thank you.
Thank you, Director. Yeah, so just our last meeting was in March, face-to-face meeting, and COVID was on the agenda. And, from a Director Arroyo standpoint and our committee standpoint, we kind of, been out in front of this prior to it coming. At that point, I think it was just a couple cases in Seattle. So look at the times and how they've changed. Okay, so the second item, again, what we're trying to do here, Director, is just talk about, some high-level things from the constituent side. Of course, with COVID, there's so much of flood information, but returning to work best practice. So there is some confusion, both on the employer side, employee side, as to someone that gets, tests positive for COVID, and then it's time to return to work. We have families that are in great need and need to go back to work and need to get paid, and the family resource, the FFRA, only lasts for a couple of weeks, and folks may be rushing back to work too soon, or there may be pause or cause from an employer side about folks returning to work. Can you tell us just I know we've talked about it, but if you can just share with everyone what is the right way to return to work if you test positive for COVID?
Sure. So we are and continue to follow the CDC guidance on return to work. CDC guidance is based on a time-based or symptom-based strategy. And that strategy is that you are 10 days from the start of symptoms, or if you're asymptomatic from the date of the test, that you are 24 hours fever-free, and that your symptoms have markedly improved. So doesn't mean your symptoms are 100% gone, particularly as it relates to loss of taste and smell. That can take weeks to come back in some instances. But if you were coughing, you had a very hard cough, that cough has subsided quite a bit, that you don't have a fever, you're not feeling the chills. If you had GI symptoms, that they are markedly better. So that is what we call the symptom-based approach. And the soonest that you can return to work would be 10 days. For some individuals, that can be longer. If you had a serious bout of COVID, your return to work can be extended. And that's where we would recommend that you speak with your provider, because obviously if you were that bad, you were likely went to the hospital or have spoken to your provider, or have the provider that you worked with at the hospital who can extend that isolation period. Or if you're severely immunocompromised, that may be another indication that your isolation period will be longer. But generally speaking, 10 days is, on day 11, you can return to work if you meet those three conditions: 10 days from the start of symptoms, or if you remained asymptomatic the entire time from the date of test, 24 hours without fever, and a marked improvement in symptoms. That is that. I know that there are providers requesting tests to go back. We can't tell, employers, we can't tell employers what to do. We have and will continue to reiterate the fact that CDC, this is their recommendation. There's concern if we have too many people rushing to take tests to return to work, we're also sort of clogging up the system. think you've seen that there's been large increases in the number of people getting tested. That seems to have subsided a little bit after the holidays, but I suspect it'll start picking up again. You know, if there's not a need for you to get that test to return back to work, then you can use the CDC guidance. And then if we're working with you, we're also working internally to develop a letter that our contact tracers can provide to individuals who have completed their monitoring of their isolation period to their provider that reiterates this and stating that this person has completed their isolation period per the CDC guidance. But again, we can't control what employers will say or do or require of their employees, but our guidance has and will remain the same. You know, there may be certain industries that may require this, and so we know it's come up sometimes in healthcare where they are requiring the negative test, and obviously you're seeing many people, so there might be a safety factor or that perception factor that you can say everyone is tested negative to COVID. But again, what we're being told and what has been seen as we learn more about the virus, remember, is that if you have a general sort of run-of-the-mill case of COVID, you are not infectious on day 11. They've not been able to cultivate a virus that is infectious post 10 days from onset of symptoms. Again, of course, unless you had a very severe bout where you might have a higher viral load. And part of the reason in suggesting that you don't take a test is that the PCR test, it's designed to be a very sensitive test. It's designed to find fragments of the virus in your system. And so you may no longer be infectious, but still have fragments of the virus in your system, and you will test positive. We had that happen, as Councilwoman Rossetti knows, with some individuals that she took in from our isolation center. We had several gentlemen who had been with us for a month and continued to test positive. But per CDC, we're not infectious. We got the revised guidance from the CDC when we had these gentlemen staying with us, but we continued to test them, and they continued to test positive. They had no symptoms, were completely fine, nothing wrong with them, but they continued to test positive. And so once the CDC revised their guidance, we did release them, but some of them, again, tested positive 3 weeks, and another one was like 25 days after their initial test. So you will keep people out for a really, really long time. In some instances, those individuals that continue to test positive, you keep them out for a really long time and they're not infectious and they're not a threat. And again, if you know, you're doing the mitigation strategies, that's why you still continue to wear a mask. That's why you still continue to social distance and wash your hands.
So a couple points, Director. The first thing is, you know, look at how we've come where in December we say if you have the run-of-the-mill COVID, right? Like, you know, can you imagine in April, you know, saying that? But I mean, I think to the testament is, you know, the more that we're finding out about this, that we can actually say that and provide that label. So the other piece is you mentioned the word provider, but I think you meant employer, right? That's
yes,
some provider.
Yes,
yeah, you meant employer. Okay, all right. I just wanted to just make sure. And with everything being said, and you were talking about testing and clogging the system, do you still recommend just testing regularly, whether you're symptomatic or not symptomatic? Is that still beneficial?
Yes, absolutely. We do know that a lot of the spread is asymptomatic spread. Someone bringing it in with no symptoms, and sometimes those individuals never develop symptoms, but yet other people in a family may develop symptoms. So I still recommend, because you're not clogging up the system, you are actually checking to make sure. But once you've had COVID, that's a little bit of a different situation. You are presumed to be immune or have immunity for 90 days. So past that 90 days, if you're still out and you're an essential worker, you're out there working, I would again recommend to get tested regularly. Places like Hartford, where we have multi-generational housing, high density, population density. We're a very small city and a lot of people in a small crammed area. Yes, and high rates of community transmission. Absolutely, I recommend getting tested. You know, I myself and my family are on about a monthly basis. We try to get tested. again, I definitely, if I knew that there were exposures in my family, we would get tested more often, but we've been, you know, we know where we go and we know where we're at, and we're not hanging out with other people.
So you heard it here first. Director Arroyo recommends at least everyone one monthly test. Breaking news, one monthly test.
If you're working outside of your home, absolutely, because again, you just don't know those exposures, right? If you're home and you're just curious and you know you go out for shopping, you're in a high risk category. Still, that's what it's here for. Again, we know if that asymptomatic spread, you're not clogging up the system doing that. If that needs to happen, it's just, again, if you've already been exposed, if you've already had COVID, to get a test to clear yourself to go to work is not indicated at this point in time, unless, you know, again, you're in healthcare or something like that where an employer may require it. In those instances, other instances, it's not really indicated.
I think that's important, Director, you know, with the testing. You know, folks don't know like how often they should go. I know we have in the city of Hartford plenty of places where folks can take tests. With Chatter Oak Health Centers, the FQHC, I forgot, federally qualified health centers. We have, you know, at the schools, we have, you know, the CVS, we have the rapid testing at Arroyo. There are plenty of places for folks who are listening in the community where we could go take tests. And I think it's important, you know, to be, you know, when we talk about being responsible citizens, the social distancing, the hand washing, the mask, but I think we need to add that level of testing regularly as well to part of being socially responsible in terms of COVID. You know, I think the biggest thing is the asymptomatic piece. So, Councilwoman Rossetti?
Through you, Mr. Chair. Director Arroyo, do we know are we going to do rapid testing at Arroyo through past December 31st?
I believe that the conversation is ongoing about that.
So with that being said, I know you touched on vaccine distribution. I think the higher level questions in regards to vaccine distribution or the vaccine itself when it starts rolling out here in Hartford, the biggest question is do you have to take the vaccine once or do you have to take it twice? How does that work? And then also, in terms of the rollout plan, I know it's done by, I'm not sure if that's the decision that we make, but I think those two questions in regards to vaccine distribution is, you know, how many times are we going to have to take this vaccine? And then number one, and then number two, what's the rollout plan here in Hartford?
So that first question in reality has two parts. So I'll address the first part, then the second part. So the first part would be the vaccine, how many doses do you need? You need 2. So the 2 vaccines that are going in front of the FDA for emergency use authorization, the EUA, that they refer to by shorthand. The first one is Moderna. That's going on, first one is Pfizer BioNTech. That is going on the 10th for the EUA meeting. It is expected that it will be approved based on the data that we have or that we've seen. More data has been provided to the FDA, obviously, but it is expected that it will be approved under the EUA, and there can be needles in arms as soon as December 14th as a result of that. And so that particular vaccine requires 2 doses. That vaccine will be administered through the hospitals as well as through pharmacy chains, because the first individuals that will receive that vaccine are the priority group 1A, which consists of our elderly population, skilled nursing facilities, assisted living facilities, and I think that's it. Nursing homes are skilled nursing facilities. So they're in those areas, as well as healthcare providers that are working with individuals with COVID or can be exposed through their work. And then the other piece is medical EMTs. So EMTs, meaning on ambulances, can be exposed to COVID through that work. So I believe that is for Group 1A. Group 1B are what are considered those critical infrastructure workers. And then it will be people over 65, not in these congregate care settings, and then people under 65, I believe, that have medical conditions. So I don't have the full list in front of me, unfortunately, at that time, but those are sort of the big buckets. There will be some prioritization in there, but it is 2 doses. The second part of that question is, will we have to continue to take this vaccine?
Excuse me, through you.
Mm-hmm.
How far apart, Director, through you, Councilman, how far apart are the doses?
1 month, 30 days. Yeah, and I forgot also in Group 1B, it's congregate care settings, which would include, I believe, homeless shelters as well, Councilwoman Rossetti, so I forgot about that. But congregate care settings.
We already filled out our paperwork, I think.
There you go. So that would be a part of Group 1B. The doses are 30 days apart, and so we here at the city, as well as at the state, all of the providers have been working on getting their systems and opting into the state system on vaccines because they have a process that we have to follow and all of that. But then the second piece around the question around whether we have to continually take this vaccine, that is an unknown at this point in time. And then just so that you know, for Group 1A, I said that, you know, there could be needles in arms as soon as December 14th per the governor and those conversations that are happening there. The second 2-dose vaccine is the Moderna vaccine. That vaccine is going for EUA, the EUA meeting on December 17th with approval and the possibility of needles in arms as soon as December 21st. We will likely play a role in helping that process in terms of being a vaccinator at the city of Hartford. So we are preparing ourselves for that. But that's what we know in terms of the vaccine.
Thank you. So I say this, I ask this question, completely tongue-in-cheek question. When do council members, what part of the list? Are we like last on the list in the city of Hartford? I'm okay with it. I'm not sure if my other council colleagues.
You're like 10F.
So
hey, that's all right. That's all right, Councilman, because I have a feeling if you're 10F, others are even below that.
Majority Leader, what'd you say?
I said, speak for yourself. I'm part of the in the top tier.
Okay.
Yeah.
All right. So it's all over the place.
I don't know, Councilman Clark. I'm not a part of 1A. I'm 1B, so I don't know.
I'm fine with being 10F.
I was a little upset that I wasn't 1A. 1B.
And I think it's important
honestly,
also.
You know,
Yes, but
sorry. I was going to say, you know, I know there's a lot of questions. I did have a meeting today with, you know, with our partner / contractor on our COVID project. We did do 7 focus groups with a diverse cross-section of residents here in the city, older, younger, Black, white, Asian, Spanish-speaking, English monolingual, around both flu and COVID, and there was a lot of overlap. And so we're going to be putting some stuff together to answer those questions, particularly around like, why was this approved? So like, how did this vaccine get done so quickly, and give information about that. Because I think there's a lot of misinformation that our community needs to know about. And we hope that providing that information will get them ready for when the vaccine is actually available for the general public.
And I think it's important. I know we were just laughing, but I think it's important as elected officials at council that we be role models in this, right? Like there's a lot of speculation and a lot of concern in our community around taking this vaccine. But I think, you know, if folks who are listening today, as you can see, you know, we're definitely interested in taking the vaccine, and that concern isn't there. And so I think as models, and you know, for the folks that elected us kind of showing the way, like, listen, this is the way from a pandemic to end up an endemic. And I didn't, you know, I learned that word from you, Director. So thank you so much. So with that being said, is there any other business, my colleagues? Do you guys want to bring up any other business? All right, seeing no other business, I'll take a motion to adjourn.
So moved.
So moved. All right. Good night, everyone. Everyone have a great night and be safe.
Good night.
Night.
Good night.
Good night.